let's talk about lymphoma, which is a cancer of the lymph nodes. This falls under the concept of cellular regulation, which just means, the cell is the basic structure of the human body, forms organs, organ systems, and organisms. So this would be a disorder of the cells in the lymph nodes. So this is a mutation of one single cell, which then proliferates and forms a solid tumor in the lymph. And since the lymphatic system kind of spreads through the whole body, this can easily move through that lymphatic system into other organs, invade other organs, and metastasize. So lymphoma is more common in men, so that is a risk factor. It's one of the more common childhood cancers that we see, and the incidence is also higher in Caucasians. We can divide lymphoma into two types. There's either Hodgkin's or non-Hodgkin's. And the only real difference there is that Hodgkin's lymphoma has the presence of a specific type of cell called a Reed-Sternberg cell. This Hodgkin's is also more common in children and young people, and it's usually more predictable than non-Hodgkin's lymphoma. So non-Hodgkin's lymphoma does not have those type of cells. It's definitely more common than Hodgkin's lymphoma, but it's also, since it's more unpredictable where it's going to move to, it is a little bit deadlier than the Hodgkin's lymphoma. Some manifestations of lymphoma would be painless swelling of lymph nodes, low-grade fevers, night sweats, and unexplained weight loss. So those are kind of the classic symptoms. So that's usually when people come in, we ask them those questions. Have you had any unexplained weight loss? Have you had any night sweats? So that would be part of how we diagnose it through that H&P. You can also do some laboratory tests, such as a CBC, where we may see either increased red blood cells or decreased red blood cells, or some, especially if there's bone marrow involvement. We'll do radiology testing like CT, CAT scans, or x-rays. We could do a PET scan, and that might show us those solid tumors in the lymph. Sometimes those lymph nodes are deep and they're difficult to feel, so this would be a better way to see that. Then we would do a lymph node biopsy, where we're taking the cells out of the lymph node and looking at them under a microscope, and that would be our definitive diagnosis. We can also do bone marrow biopsy or even a lumbar puncture if we suspect that there's neurological involvement. So treatment is going to involve chemotherapy and radiation to that site. We can remove that tumor or even remove the whole lymph node there. We can also do a stem cell transplant. Lots of complications with lymphoma. They can develop superior vena cava syndrome, which is when there is compression on the superior vena cava, and it causes a backup of that blood flow. So you would see kind of an upper body edema with that. If there's involvement with spinal cord, you can see spinal cord compression. The cancer cells will produce a protein that kind of mimics parathyroid hormone, so you may see too much calcium in the blood because of that, so hypercalcemia. Myelodysplasia is when there's bone marrow involvement, it's going to impair production of bone marrow products, so red blood cells, white blood cells, and platelets. Could cause an overproduction or an underproduction of those cells. You may see liver or kidney dysfunction or impairment or failure because of this. Because of that myelodysplasia, sometimes it'll cause a polycythemia, and that is when there is an overproduction of red blood cells. That is not a good thing. It causes the blood to become too viscous, so that hyperviscosity of the blood can lead to thrombolytic events. So it'll cause the blood to clot more frequently, and that can lead to DVTs, PEs, MIs, strokes. We don't want clots in the body. And it can cause a clotting in any organ of the body. So those are our complications. So again, do your readings. Make sure you come to class ready to talk about this, and we'll get a little bit deeper into it. I'll see you there.